Deep vein thrombosis is a condition where the body makes a clot, a blood clot. This condition is something that you can't see or feel, but there are symptoms that can lead doctors to diagnose the condition. Those symptoms include swelling of the lower leg or even pain in the lower leg. Many people have difficulties with swelling of the legs or pain. But the most important thing is if it's a new event or if it's something that has just occurred, that is when you seek medical attention. We're planning to do an aneurysm surgery. This is a abdominal aortic aneurysm. And you can see with this technology I can spin the aneurysm around. I know exactly where it is. I can do very specific measurements to figure out how to treat this. This is still a leading cause of death in the United States. The problem is that people don't know they have it. If the situation is severe, there are different options today that we did not have before. In the severe situation, we use special medications called clot-busting medications to break up the clot and remove this. We often use small catheters where we actually insert inside the vein or the body to help deliver those medications. One newer technique is to use sound waves that are really ultrasound, but these sound waves help break up the clot in conjunction with the clot-busting medicine. It can be caused by prolonged sitting, with a long car ride, or on a long airplane ride. That clot can move to the heart or lungs. It can cause severe damage to the small valves that sit inside the vein that allow the blood to flow in the proper directions. Most people learn to appreciate their health after they've lost it. So to prevent that, it's important to have good lifestyle habits. Cigarette smoking is one of the major problems in this country and can cause problems with clotting disorders. Obesity is another major problem in this country, and also is related to clotting disorders as well as heart and vascular problems.
On the leading edge of technology at the Abbott Clinic, a new option to treat deep vein thrombosis.
DVT, or deep venous thrombosis, is basically a blood clot in the deep veins of the leg. It's a very common problem in the United States. We see an average of 900,000 cases a year, 275,000 directly from the emergency room. The patients at risk for deep venous thrombosis are those that have serious medical conditions. People with cancer, those that have had major hip or major abdominal or chest surgery are also at risk. Those patients who are immobilized, who are bedridden from a serious illness, or sometimes unfortunately from paralysis, say from a car accident, are at risk. But people just out on the street can also develop a deep vein thrombosis. Sometimes it's related to a medical condition we call a hypercoagulable state. Those patients who have an abnormally high or low level of certain types of blood factors can be at risk. We actually have blood tests that can identify those patients. And you can even get it from a long car ride or, say, an airplane ride. It's been termed coach class syndrome in many parts of the world when you're cramped up in a little airplane seat for several hours. The main problem with DVT is a condition called pulmonary embolism. Pulmonary embolism is when the blood clot in the deep vein breaks loose and floats up into the heart and into the lung artery, the pulmonary artery. It can affect oxygen levels. It often presents with a sudden onset of low blood pressure and chest pain. And unfortunately, it can be fatal. There are different ways to treat it. The traditional method, again, was the use of blood thinners, and particularly an oral anticoagulant called Coumadin. And historically, we used to actually do an operation to remove the blood clot from the deep veins. But nowadays we can do this minimally through a minimally invasive technique, and that can involve a catheter introduced into the vein to drip a medicine to help break the clot up. It's called thrombolysis. But the newer devices that are out, there are two of them that we use quite often. One is a catheter called an Angio Jet Catheter, which basically uses a jet stream to break the clot up and to suck the clot up. It is very similar to the power washer you use to clean your driveway. But we've also used a different type of device called trellis. And trellis is a similar principle, except it has two balloons that inflate and vibrate a catheter in a clot buster solution. And then after several minutes, we suck the clot and the clot buster medicine out. The advantage of trellis over the traditional catheter thrombolysis is that you don't put the clot buster medicine into your body. It stays localized, and you can use lower doses of it. And we've had great success. We have had several people who have had complete clearance of their blood clot within an hour of starting treatment with the trellis.